Welcome back, and here we see the part 2 of on the dysphagia. So in first part we mostly saw on oropharyngeal dysphagia, but this time we will talk about the esophageal dysphagia. Actually, there is problem in the esophagus that makes the bolus food or solid or liquid. We will also see that we have difficulty in swallowing of the liquid in the esophageal dysphagia. But in oropharyngeal dysphagia, we mostly saw the solid dysphagia. So when there is difficulty in the propagation of food down to the esophagus, we see that there is esophageal dysphagia. And the things that arise within the body of the esophagus, like we see if there is some the spasm, like esophageal spasm, the other things like achalasia, in which the lower esophageal sphincter is not able to relax. There is some mechanical things like corkscrew, the motility disturbance like the aperistolysis. When we see there is not well innervation to the esophagus, there may be a problem that causes the aperistolysis. Well, the esophageal diseases that cause dysphagia. The first one is achalasia. We see that there is a bird beak. We see that the lower esophageal sphincter is not relaxed. It's contracted, means there is a stimulation of the lower sphincter, which is not able to relax. What are the non-achalasia motility disorders? We see here the corkscrew presentation in the esophagus, like there is no achalasia, but whole esophagus is disturbed, means there is abnormality in the esophagus. And the strictures, there may be some strictures in the esophagus causing the dysphagia, like we see this is the normal esophagus, and the food can enter easily. But if there is strictures like this, we see, and the food is not being entered into the esophagus, there may be some neoplasia, like some tumors in the gastroesophageal junction. These tumors may enter into the esophagus that cause like a border that makes food not enter into esophagus, that cause the dysphagia. And well, we saw the Zenker diverticulum. You can also see in this slide that was in the oropharyngeal dysphagia, but we also have diverticulum in the esophagus like this. This may also cause the esophageal disease. That is also leading to the difficulty in swallowing, that is the dysphagia. Some foreign bodies may also enter into the esophagus, like if, for example, if a patient is not in a full consciousness, that may inspire some foreign body that is like stuck in the esophagus, that makes the difficulty in swallowing, and that is the esophageal dysphagia. I also told earlier that the rings may cause the dysphagia, or some webs. We will see these in differential diagnosis of the dysphagia further. The gall, some extraesophageal gall, like there's no problem in the esophagus, but we see outside, like in trachea or others problems like which are present in the mediastinum. Some pill-induced injuries may cause, like when they're causing the injury, there may be some spasm in the esophagus. This spasm also makes difficulty for the food to enter into the esophagus. The infectious esophagitis, there is inflammation of the esophagus, and that may be some, like we mostly see the eosinophilia. Some helminth infections cause the esophagitis. Some caustic injuries also may lead to this dysphagia. These things actually shows the non-achilles myotology disorders, like jackhammer esophagus, distal esophageal spasm, the esophagus junction outflow obstruction, e.g. JOO. That is the mnemonics for this big name for the non-achilles mortality disorder. Well, I will show algorithm in this slide, that is for the evolution to the approach to the dysphagia. I just will give an overview on this. Dysphagia, we see the difficulty in swelling. Then we should know that what should be the next step. For example, if we see that there is difficulty in initiating swallow, that the patient cannot initiate swallow, we will see that the patient has oropharyngeal dysphagia. Well, if food stick after swallowed, for example, if the patient has even initiated the swallow and it is sticked into the esophagus, we can go that there may be some problem in the esophagus, that is the esophageal dysphagia. And one thing I should tell you that in the oropharyngeal dysphagia, we only see mostly the solids that cannot be swallowed. But when the esophageal dysphagia occurs, then we should know if the patient has the dysphagia to solids only, we then will go further assessment for the dysphagia. When we see that if there is solid, then we can go that there may be some mechanical obstruction in the esophagus, like if it is intermittent, like the it's going and then it's stopping, then we see that there is a ring in the esophagus. We can also you can search in the Google that what is ring. Ring is actually a ring in the esophagus that is obstruction of the esophagus and will not allow the food particles or solid, mostly solids, to the esophagus. And the mechanical obstruction, if there is progressive, like it's not getting well, the dysphagia is going to be progression, then we see that there may be some stricture or malignancy. If you remember, I showed you the stricture, what is stricture, and malignancy like neoplasia, the gastric esophageal tumors. Well, we went to this site, and now we will go to this site that if the patient comes with food that is that he has swallowed the food, but it is sticked in the esophagus, like the patient has swallowed but it's sticked, then we see what is problem. If the patient has swallowed solids and liquids both, then we see that there is problem in the motility disorders, because motility disorders may cause the difficulty in swallowings of the solids and liquids, these both things. If the intermittent, like it's being down, going up, then we see that there is esophageal spasm. Well, in the side of the progression, we see that it is achalasia or scleroderma. I think I didn't talk about this scleroderma. Scleroderma is actually the disease that may cause the problem in the dysphagia, like it may have chest pain during the, it may or may not have chest pain in the dysphagia thing. Well, actually, this whole approach is important for the dysphagia, and the dysphagia is almost finished here. Hope see you in next slides. In next lectures, you will see the approach or the diagnostic test of the esophagia and the treatment of the dysphagia. Till now, I finished the dysphagia. Thank you, and hope to see you in next videos.